Hello Alliance team members. I miss being able to be all together in the same room, but during this time of social distancing, we are having to get creative about how we communicate with each other. For that reason, I've decided to record a video discussion of the steps that are being taken to reduce the spread of COVID-19 in our health center. We will continue the current measures, which include screening patients both over the phone and on site when they arrive at our centers. Any patient who is screening positive will be diverted to our automobile triage area and also given a face mask to wear during this process. Any patient who is then screened and released from automobile triage, not being deemed appropriate for testing, will return to the health center but with a face mask on during the visit. We also are trying to reduce in-person, face-to-face visits with patients and diverting most patients to telephonic visits whenever possible. Beginning Monday, March 30th, we will also be requiring all clinical staff who need to come within 6 feet of a patient in order to perform their job duties to wear a face mask while doing so. This is an important step to protect your health. We know that there is community spread in Sonoma County, which means that we could have individuals coming to our health centers who are asymptomatic and still infectious. For this reason, we feel that this measure is vitally important, and we want you to have the tools you need to stay safe. Currently in Sonoma County, there are 58 confirmed cases of COVID-19. Of those 58 cases, 7 are residing from Windsor, Healdsburg, and Cloverdale, so we know it is already here. We have at Alliance tested approximately 50 patients. All of those patients have been negative thus far, but that doesn't mean that things couldn't change this week, and we want to be prepared if they do. There is, as you may know, a global shortage of personal protective equipment, including face masks. For this reason, we need to be very careful and systematic about how we use these resources. We are doing absolutely everything in our power to secure more face masks as well as other personal protective equipment, but in the meantime, we need to follow guidelines in order to extend the ability to use this equipment and continue to see patients. The Center for Disease Control have published guidelines for recommendations optimizing the supply for healthcare centers when supplies are limited. Those include the extended use of face masks, which involves using a single face mask for multiple patient encounters without removing the mask in between. In order to do so safely, I want to demonstrate how we're going to be doing that in clinic. And so come Monday morning, each person working in a clinical setting and providing direct patient care will be given a face mask. They will also be given a bag and asked to write their name on that bag. The face mask should be applied to the face using the ear loops on either side, and you just put it over your mouth and your nose like this, and slightly squeeze the top so you get a good seal across the top. One thing to remember is once this mask is on, think of this outside surface as being contaminated. What that means is if you touch it with your hands inadvertently or to adjust it for any reason at all, you need to immediately perform hand hygiene before touching any surfaces, touching yourself, or touching a patient. When you have completed your day's duties and are ready to remove your face mask, you want to do so utilizing the ear loops. So first you perform your hand hygiene, then you grab the elastics behind the ears and pull the face mask off, being careful as much as possible not to touch the outside surface of the face mask. When you're ready to store your face mask, you need to fold it in half with the outside surface touching itself. So you'll have basically the part touching your face on the outside and the part that it was originally on the outside folded in. You then want to take your bag and place the mask inside of your paper bag, and this is basically just to create a physical barrier to prevent any contamination of the mask while in clinic. So you're going to put that inside of your bag, and then you'll also be given a paper clip, and that's just to keep the bag closed and make sure nothing contaminates the mask once it's in the bag. It'll be stored in the bag where it can breathe and dry out until it is ready to be applied again. Each Monday or each day of your first day of the week, you will then receive another mask and be able to use that. If at any time you need another bag, there's no shortage of those, so please feel free to ask your supervisor for an additional bag, and we'd be happy to provide that for you. During our current circumstances, I do realize that this is extremely challenging. We are all experiencing intense emotions on a daily basis. Please take a moment to allow yourself to process these feelings and to recognize that we are all in this together. If we can take our thoughts and turn them towards kindness and compassion, we can help to spread kindness as contagious as COVID-19. It's important that we support each other and that we create a safe environment for each other to process the feelings that we're having. What you do now can truly make a difference for Alliance and the community we serve. Thank you and take care.